Should I give it just another minute, do you think? Okay. Okay, I think I'm going to go ahead and get started if you guys are ready. Okay. Hi, everybody. Thank you so much for joining us today. My name is Lori Keel. I'm the manager for field development for this region. I'm based right up the road from you guys in Seattle. So I am your regional staff person. If we've never met before, I'd love to change that. I encourage you to reach out. I'd love to connect with you guys. My contact information will be in a follow-up email. Before we get started with today's topic, I want to take just a moment to acknowledge the important and difficult national conversation going on about systemic racism and inequality fueled by nationwide protests over the death of George Floyd and others. Autism Speaks has issued the following statement. Racism and discrimination have no place in our society. Deeply ingrained in the Autism Speaks mission is a commitment to creating a more equitable world for those we serve. The autism community is diverse and broad, including all races, ethnicities, abilities, socioeconomic groups, belief systems, and identities. We stand with our volunteers, our colleagues, our partners, and every member of our community in speaking out against racism and speaking up for a world that's more inclusive and empathetic, one where all people are respected, protected, and valued. Thank you. Now that you know where we stand, I'd love to start by telling you guys about our mission, which is to promote solutions across the spectrum and throughout the lifespan for the needs of people with autism and their families. We do this through advocacy and support by focusing on 5 key mission objectives. Those are increasing global understanding and acceptance of people with autism, being a catalyst for life-enhancing research breakthroughs in the areas of causes and better interventions for autism and related conditions, increasing early childhood screening and timely interventions, improving the transition to adulthood, and ensuring access to reliable information and services throughout the lifespan. It's now my pleasure to introduce you to Judith Ursetti, Autism Speaks Director of State Government Affairs. Judith?
Hi, thanks, Lori. Thank you so much. And thank you so much to our Oregon friends for joining today. I know many of you I've spent time with in the Capitol working on insurance reform, and Oregon is a vibrant community, and I'm so thankful that you guys joined us today. We want to talk with you about our advocacy efforts on the federal and state level. Those are very much informed by what we're hearing from our community and the challenges that they're facing during the time of COVID-19. Autism is a gift in many ways, and it comes with many challenges for some of our community, and that has been compounded during this time. We know that educational services have been extremely disrupted over the last couple of months, and there's a lot of confusion about what's to come in the days ahead in the world of education. Day programming isn't available in many places right now. Healthcare clinics and other sorts of relative services aren't available in the clinics that normally serve us. The shift to telehealth for some has been amazing and really a wonderful gift, and for others it's been impossible. And so we're hearing a lot about that. Mental health supports are so important for people on the autism spectrum and their family members too. There's a lack of connection that can be so individual in our families' lives, in autistic individuals' lives. I always talk about the connection my son Jack has with Outback Steakhouse and the staff that work there. Jack asks to go there every Saturday. He wants to have wings. And it's so much more than going there to get the wings. It's about seeing the people who know him, who see him, who value him. And the light that comes up in his face when he's engaging with his friends at Outback is so important and so valuable. And right now, that's not available to him. I mean, sure, we can pick up the wings and bring them home, and we have been doing that. But we miss that connection for him. It's a very simple example. There are many other examples that you all are living that we're hearing about. Community employment. So many people with autism have worked for years to find their place in the community and to show the value they have in their positions of employment, and that has been disrupted. Respite has been disrupted. Routines are all over the place. Loss of income for families and for autistic individuals has been devastating. People are dealing with challenging behaviors, aggression, self-injurious behaviors. Those are realities that autistic individuals face, their family members face. And it's so difficult during this time, especially when people are concerned about calling for help or going to the hospital for help. Accessing healthcare is another challenge that we're hearing about. There is discrimination that's occurring in clinical and hospital settings against those with disabilities that we're very worried about. We're worried about rationing of treatments and caregiver access during time of hospitalization, and we're hearing a lot of those worries from our community. And these are just some of the things that are informing the advocacy that we're doing on the federal and state level. If you have anything to add to this list, I'm sure you do, please let us know. And you might have noticed that you're muted and that your videos aren't on. That is just to save broadband so that we have a good number of participants who are able to participate today. So we apologize. We will stop and do questions after each section, so hang tight. But if you do have something to say, Kelly Hedrick, who directs our grassroots and state government affairs, is monitoring the chat box, as is someone from our autism response team. So they are there for you and will be monitoring the chat box. If you do have an individual question that you need to talk more about, please contact our autism response team. We have an amazing staff. There's a number that is for Spanish-speaking individuals. You can email help@autismspeaks.org, or if you go to our website, autismspeaks.org, there's a chat window that pops open too if you just want to chat. So lots of different ways to connect. We want to be here for you and support you during this time. So Lori introduced us. Thank you so much, Lori. I encourage you to get to know Lori. She's amazing. Dave Sikowski, who heads up our federal advocacy, is going to be talking with you very shortly about what's going on in DC these days and over the past few weeks that's really relevant for our community. I'm going to talk with you about state advocacy concerns and efforts, and then we have a really good presentation about supports that are available to the community right now through our community outreach team. So Marianne Sullivan, who many of you know, is going to share with you about that. So that is enough for me for now. I'm going to turn it over to Dave. And Dave, if you would talk with us a little bit about what's happened in Washington, D.C. federally and what we're thinking about going ahead. Thanks so much.
Thanks, Judith. Great to be with you all today. So as Judith mentioned, my name is Dave Sikowski. I work on our federal advocacy team based in Washington, D.C. And what I wanted to go over today was what has happened in Washington since the outset of the COVID-19 pandemic, just broadly in terms of the response. There's lots of news articles, and wanted to just provide a condensed version of that, as well as talk about what specifically we've been advocating for related to the autism community and concerns that Judith mentioned just a couple minutes ago that we've been hearing, and then talk a little bit about what we anticipate or we may see happen going forward in Washington. And you know, with all of these large federal bills that we're talking about, we're never going to get to every last detail, and I wouldn't want to bore you with every piece of minutia. So we'll touch on, I think, some of the top level things. But if you have any specific questions, please don't hesitate to put them into the Q&A box or the chat box, and we'll do our best to either respond right now or after the presentation. So, kind of going back in time a little bit to the outset of the pandemic hitting the United States. Congress began with taking action on March 6th with the Coronavirus Preparedness and Response Supplemental Appropriations Act. And this was really to provide emergency funding to help assist in the public health response to address some of the immediate needs that were occurring in communities across the country. It was really just kind of the starting point at which the federal government would start taking action. And you also note here that they're labeled, these bills are labeled COVID-1, COVID-2, COVID-3, and really that's just the way that people in DC are referring to these bills as in chronological order from when they were passed. So that's what that reflects there. I just wanted to make that clarification. So, you know, understanding that, of course, with that first bill, there was going to be a huge need for additional action. On March 18th, Congress passed the COVID-2, the bill, the Families First Coronavirus Response Act. So that was the bill that provided emergency paid sick and family leave. We have a lot more information that we could send to any of you who have questions about the eligibility. We have the Department of Labor's issued a pretty extensive questions and answers document that we could send to anyone who's interested on eligibility for that. That law included some tax credits, included free COVID-19 testing were available. Of course, there's been challenges with that, expanding food assistance and unemployment benefits, and then providing a really important boost to Medicaid funding with a 6.2% increase. So, you know, on March 27th, the COVID-3 or Coronavirus Aid, Relief, and Economic Security Act passed, also known as the CARES Act. And that's the law that I'm sure all of you have heard about in one way or another. This one provided $2 trillion in relief, and it spanned every aspect of our economy, and it reached both businesses, families, et cetera. So the economic impact payments, as they're called by the IRS, or stimulus checks of $1,200 per individual, $500 for dependents under age 17, were included in that law. Increased unemployment benefits, so $600, the increase of $600 per week. There was hundreds of billions of dollars to address the public health response, to state and local governments to specifically address COVID-19 related concerns. The Paycheck Protection Program was established in this law, which is a program that provides forgivable loans to small businesses to help them keep employees on payroll and keep their businesses going. I'll talk a little bit more about that in just a moment. Billions of dollars for schools and for education. So this is both higher ed and elementary and secondary education. Judith will talk about this a little bit more later on in terms of the breakdown of funding and what Autism Speaks is doing specifically in our advocacy around how state and local governments are spending those funds and how they could do it in a way that benefits the autism community. And lastly, but not least, the law also extended the Money Follows the Person program through November. If we go to the next slide, please, Judith. Thank you. So even after the March 27th law passed COVID-3, there was a lot of discussion that there would have to be another large relief package at some point down the road. And really there's been a lot of discussion in Washington, a lot of discussion amongst the leadership of Congress on what would come next. And frankly, there hasn't been a whole lot of agreement yet on that. But on April 24th, Congress did pass a law called the Paycheck Protection and Program and Healthcare Enhancement Act, also known as COVID 3.5. The reason it's a 0.5 is that it very narrowly addressed concerns related to the Paycheck Protection Program, that forgivable loan program for small businesses. It was initially provided with $350 billion in funding, and because of the tremendous problems and challenges that small businesses are experiencing, there was a huge demand, and that money ran out very quickly. And so there was an effort to try to replenish those funds, and through some additional negotiation, there was funding also provided for additional funding provided to hospitals, healthcare providers, and testing to assist in the COVID response. But this bill was very narrowly targeted at just those issues, and really discussions are continuing on what else can be done in terms of providing relief during this time. Go to the next slide, please. So throughout all of these bills that I've talked about before, and really continuing on as we look towards potential future relief packages, we have been engaged at the federal level and at the state level too, as Judith will talk about more, on what we can do based on hearing the concerns of our community during this crisis, and what the federal government could do more of as they look at providing additional relief. So the first item here, additional funding for home and community-based services, ensuring that there's access. I mean, there's already wait lists that, and not every state has either participated or done this the right way. But for where there is access and where there is the ability to avail yourself of these services, or for individuals on the autism spectrum, is so important. And there's really a huge need for PPE to ensure continuity of the workforce, so providing additional pay. There's a lot of reasons why there's more funding that's needed for this purpose. Additional funding to meet the educational needs of students with autism. We know for so many students on the spectrum that the distance learning that's being provided really is no substitute at all for the in-person instruction that they normally receive. With that said, we want to ensure during this time that there is access to technology, that whatever can be done is being done to try to meet the educational needs of students during this time where they're not able to go back to school. But what we are also advocating for is that as schools are able to reopen, that they have the resources that are needed to ensure that they can make up for the learning loss and regression that we know has occurred during this time. And so on both of those ends, we really continue to advocate on both the federal and at the state level. Protecting the rights of students under the Individuals with Disabilities Education Act and other laws. During March, there was a lot of concern that that Congress might pass some waivers of IDEA, and we were very concerned about that. You all may have heard about this. There are a lot of stories, a lot of social media about this, and so we weighed in along with many other organizations as well to say that there should be no rollback on the protections, the core protections that IDEA provides to students. And fortunately, what happened was there was no waivers provided in any of the laws that passed back in March. And really what was included ultimately was the requirement that the secretary write a report stating whether or not she believed any requirements needed to be waived. She did issue that report on April 27th, and she did not recommend any waivers to the core protections of IDEA. So while we'll still continue to stay vigilant on this issue, and we will push back against proposals to try to waive the core protections against IDEA, it does seem, at least for the moment, that there really isn't any momentum on that front. And at the same time, just because there are no waivers that are going to occur doesn't mean that we don't have a ton of work to do related to ensuring that the educational needs of our students are met. Expanded access to telehealth services for healthcare needs. Again, while for some services, telehealth can work really well and has been positive. In other circumstances, it's just not the same to be able to have telehealth versus the in-person healthcare services. What we've just been trying to say is for to whatever extent possible to ensure that our community has access to the healthcare to healthcare services that they require, that telehealth should be provided. And we also are looking at ways that we can enhance ongoing efforts that are involved with telementoring to ensure that physicians across the country understand the specific needs of the autism community, and that they, especially in this telehealth environment as well, that they are keeping those in mind. Eligibility for the $500 economic impact payments for dependents over age 17 is the next one we have on here. So as I mentioned, in the CARES Act, there was the stimulus checks that were provided, $1,200 for an individual, $500 per dependent under age 17. Of course, within our community, it creates a huge inequity for dependents that are over age 17. We have joined with a number of other advocacy organizations in advocating to make those individuals retroactively eligible, and it's an effort that we're continued to engage in. There's quite a large number of members of Congress that have signed on to a bill in the House that would have done that, and in the Senate as well. And so it's something that we're continuing to fight on. According to caregivers of adults with disabilities, the same emergency paid sick and family medical leave policy is accorded to caregivers of children. So in the emergency paid sick and family medical leave expansion that was provided in the March 18th bill that passed, there were a number of different categories of eligibility, most related to COVID or COVID-related illness. But one category of eligibility was if you were a caregiver of a child whose school or daycare or childcare was no longer available, you could avail yourself of this emergency paid sick and family medical leave policy. What was less clear in the law was whether or not caregivers of adults in similar situations where the normal source of care was no longer available, that whether or not they were eligible. So we, along with other organizations as well, other individuals, advocated with the Department of Labor to make that clear. And fortunately, in the way that they've implemented the law, they have allowed those individuals to be eligible. So that was most certainly a very positive development. The next item is preventing discrimination in treatment decisions and care allocation based on disability. And this is something that we've been concerned about in terms of limited resources for the response to coronavirus, and that potential decisions being made about how care was provided, and perhaps for individuals with disabilities that it wouldn't be provided. And so we joined in applauding the Department of Health and Human Services, Office of Civil Rights, which issued a statement very clearly articulating to medical providers across the country that they should not be making medical decisions this way, and preventing not discriminating in care. subsequent to that, we've been engaged in this related to ensuring that personal protective equipment is available for group home settings. There's been huge challenges there, and ensuring that is happening. We've issued a statement related to that, as well as a statement related to ensuring that caregivers of individuals with disabilities are allowed to be with them during a hospital visit, whether it's COVID related or not. And so those are just some of the actions that we've taken. And again, we are always, as Judith mentioned, trying to reach out and listen and hear from all of you in terms of what other things we can be doing. And we continue to advocate on other issues as well. But want to continue hearing from you if there's something else that you've been experiencing. The last thing I want to mention is Congressman Chris Smith from New Jersey and Mike Doyle, who are the co-chairs of the Autism Caucus, have sent letters to congressional leadership advocating for many of these priorities. As I mentioned, we stay engaged with members of Congress on these issues and continue to, as both pre-COVID, but certainly during COVID as well, just as much. We were fortunate that we had a very short window. There was a very short window that Congressman Smith and Congressman Doyle opened up the letter for one of their letters for signatures. We had 40 members, but including Congressman Earl Blumenauer and Congressman Pete DeFazio, who both joined the letter from the Oregon delegation. So we were really pleased that they were able to do that. Can we go to the next slide, please? So what's next? All right. So as I mentioned, COVID-4 negotiations are ongoing. There has been no resolution. I'll mention that on May 15th, the House of Representatives passed a bill called the HEROES Act, which was a $3 trillion relief package that addressed issues from funding for state and local governments that are struggling, to additional unemployment assistance and stimulus checks, housing assistance, ensuring that the Postal Service is solvent, or at least on sound footing. It just really a large variety of issues. But the best way I could describe what the House did is really it was an opening salvo in the negotiations of what the contours of more relief would look like. And kind of the statement of the House's position, and particularly the House Democrats' position on what they saw as the priorities for the next relief package. But Senator McConnell has already said he's not taking up this bill as it is, and so there will have to be some additional conversation, negotiation until there's a resolution. I do want to mention a few things in the HEROES Act that were included that we hope can be maintained and over the next several weeks and months potentially of discussion. There was a substantial increase for home and community-based services and Medicaid that was provided. That was very positive. $100 billion for education. This is on top of the $1 trillion in assistance for state and local governments. The fix to the dependents over age 17 issue, and ensuring they're eligible for economic impact payments both previously and going forward. Clarifying that specific issue related to paid sick and family leave for caregivers of adults with disabilities, and $10 million for developmental disability activities. So, we will see where things go going forward. It's very fluid right now in terms of specifically a COVID-related bill passing. Every day there are more different articles that kind of pontificate as to what may or may not happen. I think one of them I saw today was that there's probably nothing happening before July 4th. And then another article from about a White House economic advisor saying that there's very likely activity that will happen before July 4th. So it's very uncertain right now. What I do know is that we will continue to advocate on behalf of the autism community, to continue to reach out and listen and try to do our best to take your concerns and bring them to policymakers in Washington. So with that, I will turn it back over to Kelly and Judith to see if there's any questions.
Kelly, how are we looking? Do we have any questions that are broadly applicable to the group, or do we need to?
We have a helpful comment. Judith, I'll mention it before you speak on state issues, since this is a state and even local hospital issue. Lydia says, we've heard that some hospitals don't want to allow communication devices for nonverbal folks. DSR has assisted them, but it's a potential issue to be aware of. So thank you, Lydia, for sharing that.
That's terrible. Oh my goodness. Okay, thank you for that, Lydia, and we will continue on. Everybody, do you need to stop and stretch for a minute? Please do. Do some jumping jacks. I know I get Zoom fatigue a little bit sometimes. So anyway, so let's talk about what's going on the state level. I'm Judith Ursetti, Director of State Government Affairs at Autism Speaks. As I mentioned earlier, on the state level, there are so many things on which we could focus related to our community. We kind of focus on 3 different areas. Healthcare is very important. Home and community-based services, those HCBS waiver services that you receive. And then of course, special education and early intervention play really important roles in the lives of our community. So we've been really trying to do things in that space during COVID-19 to help. So one thing that we've been working on are various waivers on the state level that have been made available through the federal agency that oversees all of the Medicaid services. It's called CMS. And we've been monitoring and advocating for these waivers to be made available in the states. One of them is an 1135 emergency waiver, and that's for people who access their health care through Medicaid. So if you use the Oregon Health Authority as your Medicaid coverage, then this will apply to the services that you receive. And the whole goal is that these services just be provided in a more flexible way. It's hard right now. It's hard to get around. It's hard to go to places. It's hard to access in-person services. So there are things that have been suspended. So for example, prior authorization requirements have been suspended. Pre-admission screenings, extensions for state hearing requests, those fair hearing requests and appeal timelines. Some out-of-state providers who are already enrolled in Medicaid and Medicare are being allowed to provide services. And even some services are being provided in alternative settings just to make it easier. And just know that after the webinar is over, we're going to send out a copy of this content. There are a lot of links here, so if you're a nerd, and I know there are some policy nerds on this webinar, I know you, you can go in and read, if you haven't already, the information that's available about these waivers, and there are a lot of specifics at the links that we've provided. Telehealth has been really critical, as I mentioned earlier. For some of our community, it's a total disaster, and for others, it's a complete gift. But at the beginning of the pandemic, CMS, that federal Medicaid agency, came out and said, we want to be flexible with telehealth. We want to make sure that our Medicaid services are provided via telehealth. And Oregon, of course, fell into line very quickly. And I have a copy or a link to the language for the Oregon Health Plan, telemedicine, telehealth services information for physical and behavioral health providers at the very bottom of this slide. It also applies to private health insurance services. So the Oregon Health Authority and the Oregon Department of Consumer and Business Services, which oversees those state regulated health plans, they also put forth language saying that telehealth is preferable, encouraged. So the link to that is at the bottom of this slide. So whether you have Medicaid or private health insurance, you should hopefully be able to access telehealth services, things like behavioral health treatments, those therapeutic services like speech, occupational and physical therapy, psychological, psychiatric care, and this is all in addition just to your typical well health kind of provision of services. So if you need to go to the doctor for just a typical visit, hopefully that's being covered by telehealth too. But many of these services that are so specific to our community, these therapeutic services, are now being provided via telehealth. And there's a lot of conversation on the federal and state level about what this is going to look like moving forward, whether those provisions are going to be made permanent. And we're certainly monitoring and advocating. We want telehealth to be an option. Definitely. What we don't want to see is any sort of dilution of or diluting of services. We want to make sure that people have access to the appropriate medically necessary care, whether it's in person or in some cases, telehealth would be preferable. So options are good. We just don't want services to be diluted. So stay tuned on that. Another thing that's been affected are those waiver services, the 1915C home and community-based services. In Oregon, those are the waivers that you utilize for people with developmental intellectual disabilities. That behavioral model waiver is one that really is utilized very much by the autism community in Oregon. And so there's a mechanism called Appendix K that's used during the time of national emergency. Fortunately, we don't have national emergencies like this that frequently, but Appendix K is available, and Oregon did apply and reapply and refine their request for Appendix K, and they have been approved by CMS. And so some of the things, this is just a sampling of what has been approved in those waiver services. It temporarily modifies process for level of care evaluations and reevaluations. There's an extension for reassessment and reevaluation due dates. So again, it's just all about flexibility. Virtual evaluations, assessment, and person-centered planning meetings are allowed. Provider qualifications have been modified somewhat. There is an increase in provider rates, and there's also been retainer payments made to providers to help them stay afloat during this challenging time. So I'd be interested to hear how that's working. And some of this Appendix K provision is just recently approved by CMS, so it's in the process right now of rolling out. So the goal is flexibility and sustainability of these waiver services. So hopefully that will be the case in Oregon, and we'll continue to monitor that. There's a link at the bottom if you want to read what Oregon Health Authority has to say about this. And you also have links that provide the Appendix K approval letters. If you really want to geek out and read them, you can read those approval letters from CMS. Okay, deep breath. Now let's talk about special education and early intervention. And it feels like most recently, this is what we're hearing about the most, other than the whole issue with healthcare disparity and discrimination. We'll get to that in a minute. According to Oregon, special education, they have put on the website that a free and appropriate public education must be provided. The districts will have to begin their students' IEPs to the maximum extent possible. So it's similar language to what we're seeing across the country, and families and individuals with autism have really been struggling to access remote learning during the time of closure. And now we know that the school years are ending, and so that time of closure for schools is basically over, and these IEPs should be implemented. And so it's very interesting to see now what the schools are doing around summer services, compensatory services, extended school year. There are FAQs on the website. I have a link here, but there is much more work to do around special education and early intervention. And just know that those FAQs not only apply to special education, but also EI. There has been money that has been sent down from above, as Dave mentioned, from the federal government. And we know it's probably not enough, but I do want you to be aware specifically, if you aren't already, about what came down to Oregon through the COVID-3 CARES stimulus package. So for K through 12, there was almost 141 million sent to the state of Oregon, and that was delivered to the schools via a formula. A portion of that money certainly can be used for special education and should. 139 million has been allocated for those post-secondary programs. And then there's a smaller pot of money, $33.4 million, that's going to what's being referred to as GEAR funding, governor's discretionary funding. So we have asked that on the state level that the governors who have this discretionary fund strongly consider some things that affect our community. One is hardware, software, communication devices, Wi-Fi for individuals. It's been a challenge we're hearing for rural families or families who just have very limited means and limited equipment, maybe large number of kids and parents trying to work from home. Some people just cannot access remote learning or remote early intervention because they just don't have the tools to do it, and that's not right. We're very worried about little ones who are transitioning from early intervention and they're going into special education. That's a critical time where services have to be aligned, teams have to be talking to each other, and we are asking that as needed and as the individual families desire, that this not be rushed, that it be paused so that children can remain in early intervention if they need to a little bit longer until they can actually transition in the appropriate way into special education. On the other end, if you jump to the bottom of the slide, we're also asking about that at the end of the special education time. So for students who are aging out and they've missed those transition services that are so important as you transition out of special education into the adult world or off the cliff, as we frequently say. We don't want those services that should have been provided to just evaporate. Those should be still provided if the family and the individual who's autistic so desires. So we are asking that there be flexibility there, and some of that gear funding could be used to help for that population of students who might need those services but who have aged out. The other thing that we're asking seems common sense, but unless you ask, it's not happening. Services not received during the time of school closures and remote learning, we'd like that to be provided, those services, as soon as possible, in person, if safe and appropriate for the student, including in the summer. No kicking the can down the road, no saying, oh, we're just doing sort of a diluted ESY for everyone. IEPs are enforceable, period of school closure is over, and services should be provided, if possible, for the student in person, either in their home or in some sort of setting in the school with appropriate PPE for the students and the teachers. It's challenging, the staffing, it's challenging, with the need for PPE, but it's important. There are students with autism who need services in person right now, and we're hearing from those families, they are in crisis, they need help now. So we don't want the special education system just to shut down and say, nope. We want families to have options. So that's why we're requesting that some of these funds be allocated there. Okay, so this is a very important topic that's coming up federally, as Dave mentioned, and very much on the state level. And I was emailing this week with an amazing human being named Paul Turdall, who I believe is on the webinar and who I'm sure probably all of you know. Paul is an incredible advocate, a brilliant person, a brilliant father, a dear friend, I would say, who I've worked with on autism insurance reform, along with the Autism Society of Oregon and other really amazing people in Oregon over the years. And so Paul is working with the Oregon disability community, disability rights, and others around the issue specific to what Lydia mentioned, discrimination against those with disabilities. So not having access to an iPad, not having access to a caregiver, DNR issues and do not intubate issues that are really frightening for our community. And so I actually included Paul's email on this slide. It's paul@turdall.org. He is working with this group, and Autism Speaks is joining those efforts to make sure that this discrimination does not occur in Oregon and that people with disabilities are treated with dignity and they have access to the appropriate health care when they need it, just like anyone else. So Paul, thank you for the work that you're doing. And as we've stated on our website, and as Dave stated earlier, this is definitely a priority for us. So thank you, this is important. Okay, if you want to stay in touch, and I hope you do, first of all, thanks for joining us today and for listening to all this advocacy information. You can stay in touch by following us on Facebook at Autism Speaks Advocacy. You can follow us on Twitter if you're a Twitter person, although Twitter, I don't know, sometimes it feels like the Wild West out there, but if you're a Twitter person, you can follow us at Autism Votes. Same thing on Instagram. Autism Votes is where you can find us, but please stay in touch with us. If you are not a social media person, I think you're probably really smart. Please follow us on our website, autismspeaks.org/advocacy. There's lots of information there. There's news items on the federal and the state level. And then if you scroll down to the bottom, and I would ask you all to do this, scroll down to the bottom of this page, autismspeaks.org/advocacy, and there's a place where you can sign up for advocacy alerts. Many of you are already signed up. You know we're not going to spam you, but we will reach out when we need to take action in contacting legislators or bringing the community together around an issue. So please do stay in touch. And with that, I don't know if we have any questions or comments, Kelly.
Judith, Paul wanted to weigh in on the education side as well with a couple of comments. He said that pressure was applied to them in signing an IEP agreement to remove most ABA services from the IEP during the pandemic. They refused and had to threaten to file a due process hearing request under IDEA. But he wanted to share that, and also said we could use some organization and support regarding special ed and IEP enforcement in Oregon.
Okay, so what I will do, Paul, is I'm going to email you, and then we will set up a meeting with advocates to organize to have sort of a unified front, and to also talk about what your rights are. I'm sure, Paul, you know what they are very much. But what I'm hearing in community after community is just because of the confusion of the pandemic, people aren't clear about what their rights are under IDEA. So I will reach out to you, Paul. And then for those of you who might be interested in joining us, I'm going to put my email address in the chat box. Just let me know, and we will do everything we can to support you. And with that, I'll put my email in the chat box, and then I think I will turn it over to Mary Ann, who has some really good information to share.
Hi, everybody. Can you move the slide forward? Yeah, one more. So, community outreach. I work on the community outreach team. I've actually worked in Oregon last year in Portland with OHSU, as well as the Autism Society of Oregon and Toby Rates. We had a great evening together. We did sponsor a town hall for transition to adulthood. Had a great turnout, met lots of people, individuals with autism, adults with autism. So it was a very enthusiastic crowd, and I look forward to coming back and doing more outreach, what we consider advocacy and education on specific topics. I wanted to let everybody know about the Autism Response Team. I know Judith mentioned it already. It's a really important team that Autism Speaks offers to all communities here in the United States. The Autism Response Team connects with people through emails and phone calls. So I promise you will get somebody to pick up the phone, and if you don't, they really will call you back. And of course, they respond to your emails probably within one day, if not that day. We do have a program for families. It's called the Autism Cares Grants. This is a small but mighty grant. For some families, the $250 goes a long way. Maybe you need extra groceries, or maybe your child has a special diet that you need to supplement. It's the money can be used as needed for your family. If you're interested in that grant, you can connect with the Autism Response Team at help@autismspeaks.org, and they will help you to fill out a very short, very easy application to receive those funds. The other thing that Autism Speaks is working on, and I did check this yesterday, they are updated daily. The resources, just stories in general, what families are struggling with. We hear a lot about special education, IDA, what's happening, how do we get those resources back? How is the state Department of Developmental Disabilities supporting IDA right now? Because they also have a hand in helping people and families with autism. So there's a lot going on. It's hard to weed through it. So I think we're lucky to have Paul, who has a really strong base of knowledge for the Oregon community. Could we go next slide? So I just want to point out, one of our features is our toolkits that we talk about a great deal. We have toolkits on the left side of the screen. I don't know if it's your left, but left side of the screen. Those toolkits are mostly based on milestones. This is call to action toolkit, what kinds of 100-day toolkit, what kinds of services, what's the next steps for you. It's that first 100 days, devastating days when you're given the autism diagnosis by your child. And then we move to school-age children, transition-age children, adulthood. So there are close to 48 toolkits for children, adults, lots of families, and healthcare providers. The toolkits that are in the second circle there on the right side of my screen, those are done by our Autism Treatment Network. They have been authored by experts and reviewed. They're very practical toolkits that are, how to get a phlebotomy service, how to have your child's dentist appointment be successful, how to make a medical doctor appointment. There's all those kinds of things that I know as a parent of a child with autism, now an adult with autism, they have been very useful. I'm looking at the names, how to have a EEG. I mean, we all struggle with how is this going to happen? How can we put it in play? And there's some great tips in those toolkits, and they are free and available online to us. Next slide. The other thing that Autism Speaks of is a national resource guide. And this is a guide where all throughout the country, we have resources that we have organized into many different categories. You can go in, obviously select Oregon as the state, and you look at your zip code and the resources that are available, and in the guide will pop up. Now, one thing I'd like to say is we would really appreciate it if you have services that are not in our guide. We hope that we've made it pretty simple and easy for you to go in and submit that service. That would be great, because we always want more services that are available to the number of families. Our resource guides get many, many hits a day, so we know people are looking for services, where they are, and who they serve. The other thing that is new to our page, we upgraded our webpage, I believe last year, and we have an events page. So if you're having a autism-friendly event or a pizza dine-out event or anything where you would want to invite other families to, you can go ahead and enter your event into this community events page, and it will pop up. And then others can see and join you, hopefully, in your event. So those are really two valuable resources that we offer to the community, and I think are very helpful. Next page. Also, a third plug for the Autism Response Team. This, again, team that does emails and phone calls, very helpful. And I think this is a case when you want to call the our team, because I have been surfing the web looking at all kinds of different resources for COVID, and there are many out there, but this is very individualized, so you can cut to the chase, more or less. And we all know that our time is valuable, so if you have a very specific question and you've been going through pages after pages of Corona-19 resources, I think pick up the phone and call the ART team. You will not be disappointed. Thanks for joining the webinar, and I hope to see you again this year. If not, maybe early next year.
Thank you, Marianne, and thank you everyone for joining us today. As I mentioned, we will be sending out these slides with the links, so you have access to this information. We also recorded this, so if you're awake with your loved one with autism at like 2 a.m., you can turn on the recording and it might put you all back to sleep. I don't know. There's a lot of good information here to share, so thank you for being part of it. And again, I included my email address in the chat box. It's judith.ursetti, URSITTI, @autismspeaks.org. If you want to join a call specific to the special education issues that are going on in Oregon, or if you want to continue to talk about the discrimination issues that are occurring there, let me know and we can arrange to work together on that. We want to be supportive of our community in Oregon. So everybody take good care and we will talk again very soon.
Thank you.
Bye.